Seniors, what if the way you sleep tonight is quietly setting you up for a stroke by morning? Not tomorrow, not next week, tonight. Because right now, millions of people over 60 are lying down in positions that are restricting blood flow, building pressure inside their skulls, and putting dangerous strain on their hearts, and they have absolutely no idea it's happening. And here's the statistic that stopped me cold when I first saw it in my research. 30% of all strokes happen between midnight and 6 in the morning. Not during stress, not during physical activity, while you are asleep, while your body is supposed to be healing. That number isn't random. There are specific, identifiable reasons why strokes cluster in those overnight hours. And a significant part of it comes down to something nobody talks about in a standard doctor's appointment: the position your body is in while you sleep. I'm Dr. Sarah Ellison, and I've spent over a decade as a practicing cardiologist helping men and women over 60 protect their hearts, their brains, and their long-term independence. What I've seen in clinical practice, and what the research continues to confirm, is that your sleeping position isn't just a comfort preference. For anyone over 60, for anyone managing blood pressure or cardiovascular conditions, it is a medical variable that matters deeply. Today, I'm going to walk you through 5 sleeping positions ranked from dangerous to deadly. And then I'm going to show you the 2 positions that can genuinely protect your brain and your heart starting tonight. But before we get into it, I need you to do one thing right now. Drop a comment below and tell me, are you a back sleeper, a side sleeper, or a stomach sleeper? Because in about 60 seconds, you're going to find out whether your habit is on this list. And if you're over 60, I want you to pay very close attention to everything I'm about to share. This isn't optional information anymore. So let's start with number 5. Sleeping completely flat on your back with 0 elevation. I understand why this feels right. Your spine is straight. There's no pressure on your shoulders or hips. A lot of people swear this is the healthiest position. And in your younger years, it probably was fine. But here's what your body is actually doing when you lie completely horizontal after the age of 60, and this is something most people have never been told. Blood pools toward your head. When you're lying flat, gravity is no longer helping your circulatory system. In your 20s and 30s, your blood vessels were elastic enough to compensate for that. But after 60, those vessels become stiffer. The tiny arteries inside your brain become more fragile. And when blood pools toward your head for 7 or 8 hours without adequate drainage, pressure builds inside your skull. You know that pounding headache that wakes you up at 3 in the morning? The one you've been blaming on stress or dehydration. That's not random. That's intracranial pressure. Your brain is being squeezed by excess blood volume that isn't draining the way it should. Research published in the Journal of Clinical Sleep Medicine looked at exactly this phenomenon. What they found was striking. Even a 15-degree elevation of the head significantly reduced intracranial pressure and improved blood return to the heart. Here's the scenario I see all the time. Someone wakes up dizzy. They sit up too fast and feel lightheaded. They think, I'm just getting older. This is normal. It isn't normal. That's your cardiovascular system telling you that blood flow dynamics during sleep are not working the way they should. The fix is simple, and I'll walk you through it in detail at the end. But first, you need to hear number 4, because this one genuinely surprises most people, even people who think they're already sleeping smart. Number 4, sleeping on your right side, specifically if you have any history of heart issues or high blood pressure. Now I know that sounds oddly specific, but stay with me here, because the anatomy behind this is important. Your heart doesn't sit perfectly centered in your chest. It sits slightly to the left. And when you lie on your right side, your body weight shifts in a way that compresses one of the largest veins in your entire body, the inferior vena cava. This vein has one critical job. It returns blood from your entire lower body back up to your heart. When it gets compressed, even mildly, your heart has to work significantly harder to pull that blood back in. For a healthy 35-year-old, that's not a serious problem. The heart compensates easily. But for someone over 60 with borderline heart function, early heart disease, or blood pressure that's being managed with medication, your heart is already working overtime just to get through the day. Now imagine adding 7 hours of extra mechanical strain every single night while you sleep. Here's something cardiologists have observed for years. Patients with heart failure will instinctively shift away from their right side during sleep. They feel uncomfortable. They roll over without knowing why. That discomfort is your body communicating something important. Something isn't right in that position. The European Journal of Heart Failure studied sleep positions in patients with cardiac conditions. Left side sleeping was consistently associated with better blood flow stability and measurably less strain on the heart through the night. Let me put a face to this. I've seen patients who have managed their blood pressure successfully for years. Medication stable, lifestyle reasonably controlled. But every single night, they sleep on their right side. No dramatic symptoms. No red flags on their daytime readings. What's actually happening is their heart is quietly compensating night after night, year after year. That cumulative strain doesn't show up in a morning blood pressure check. It shows up as a stroke at 4 a.m. If you commented right side sleeper earlier, please keep watching, because number 3 may apply directly to you as well. Number 3, using 2, 3, or even 4 pillows stacked beneath your head. This one catches people off guard because it feels like the responsible thing to do. People stack pillows to help with breathing, acid reflux, congestion, sinus drainage. And yes, some elevation is genuinely helpful. But excessive elevation creates a problem that almost nobody talks about. When your head is pushed too far forward by a stack of pillows, your neck bends forward dramatically. And running along both sides of your cervical spine are the vertebral arteries. These are not minor blood vessels. They supply your brainstem and your cerebellum, the regions of your brain responsible for balance, coordination, and basic consciousness. When these arteries get compressed by an unnatural neck angle, you won't feel it immediately. There's no sharp pain, no obvious warning. But over time, night after night, chronic compression reduces oxygen delivery to these vital brain regions. Have you ever woken up with a stiff neck and that dull, deep ache at the base of your skull? Most people chalk that up to sleeping wrong, muscle tension, maybe age. But that sensation can actually be a sign of restricted blood flow through the vertebral arteries, not just a tight muscle. The Journal of Manipulative and Physiological Therapeutics examined how neck positioning affects vertebral artery blood flow. Extreme forward flexion of the neck measurably reduced flow through these arteries. The study wasn't specifically about sleep, but the physiological principle is identical. If your neck is held in a compromised position for 8 hours every night, the cumulative effect on brain circulation is significant. Here's a pattern I've watched play out repeatedly. Someone wakes up every morning with neck stiffness and a headache centered at the back of their head. They've assumed for years it's tension or posture from their desk job. Then they make one change, one properly contoured pillow instead of 3, and within a week, those morning symptoms are gone. One pillow. That's the entire intervention. We're only at number 3. Number 2 is where things start to get genuinely concerning, especially because this position feels the most natural and comforting of all. Number 2, sleeping in a tightly curled fetal position. This is one of the most instinctive sleep postures humans have. It feels protective. It feels safe. For older adults especially, this position is incredibly common. But from a cardiovascular and respiratory standpoint, this posture creates 2 serious compounding problems that work against your brain and heart simultaneously. The first problem is your lungs cannot fully expand. When you curl your knees toward your chest and tuck your chin downward, your rib cage compresses. Every single breath you take for the entire night is shallower than it should be. You might recognize this feeling waking up and not being able to take a full deep breath right away, that tightness in your chest that takes a few minutes to ease. That's not a coincidence. That's your lungs having worked in a restricted state for 7 or 8 hours straight. When oxygen intake drops by even 10 to 15%, your blood oxygen saturation decreases. For someone managing cardiovascular conditions or early-stage lung disease, that reduced oxygenation places compounding stress on both your heart and your brain throughout the night. The second problem is your neck and upper back are under sustained muscular tension. In the curled fetal position, the muscles along your cervical spine stay contracted. Small blood vessels around the base of your skull remain compressed. Blood flow to your brain is reduced, not dramatically, not in a way you'd notice in the moment, but consistently and cumulatively over hours. Research published in Respiratory Physiology and Neurobiology confirmed that body positions involving significant spinal flexion reduce tidal volume, the amount of air you actually inhale per breath, across an entire night of sleep. That translates to hundreds of shallow, oxygen-reduced breaths when your brain and heart need restoration the most. Someone wakes up feeling foggy, heavy-headed, maybe a dull ache behind the eyes. They assume they just slept poorly. What actually happened is their brain spent the night in a mildly oxygen-deprived state. The adjustment here is not complicated at all, and I'll show you exactly how to make it when we get to the solutions. But first, we need to talk about number one, because this habit doesn't just involve one risk factor. It combines several of the most dangerous cardiovascular variables into one routine that millions of people repeat every single night without realizing what it's doing to their bodies. And if this is you, I need you to stop tonight. Number one, going to bed within 2 hours of eating a large meal or consuming alcohol. I know this one hits differently. Evening meals, a glass of wine to unwind, these are deeply ingrained habits for a lot of people. They feel harmless. They feel like self-care. But from a cardiovascular standpoint, this combination is the most dangerous thing on this entire list. Here's what happens inside your body when you do this. When you eat a large meal, your body immediately redirects blood toward your digestive system to process that food. That's a completely normal physiological response. But it means that for the next several hours, less blood is available for your brain, your heart, and your other vital organs. In younger people with healthy, flexible blood vessels, the body compensates for this redistribution smoothly. In older adults with even mild arterial narrowing or stiffness, that redistribution can trigger dizziness, lightheadedness, or dangerous drops in circulation to critical areas while you're unconscious. Now add alcohol into that picture. Alcohol dilates your blood vessels. Your blood pressure drops suddenly and significantly. For someone with healthy, elastic vessels, that just feels relaxing. But for anyone over 60 with arterial plaque, stiffened vessels, or a history of blood pressure issues, that sudden pressure drop triggers an immediate compensatory response. Your body tries to correct the drop, blood pressure spikes, then drops again. These erratic fluctuations place enormous mechanical stress on weakened vascular walls. In areas where blood flow becomes turbulent or sluggish, clots can begin to form. And all of this is happening while you are completely unconscious. Research from the American Journal of Hypertension studied the effects of alcohol consumed close to bedtime on nighttime blood pressure patterns. Even moderate alcohol consumption disrupted the natural blood pressure dip that should occur during sleep, what cardiologists call nocturnal dipping. When that protective dip doesn't happen, cardiovascular strain through the night increases dramatically. Let me paint this picture clearly. Someone finishes dinner at 8 p.m., has 2 glasses of wine, and goes to bed at 10. At 2 in the morning, they wake up, pounding headache, heart racing, sweating through their sheets. They assume it was a bad dream or too much food. It wasn't. That's a circulatory crisis their body is actively trying to compensate for while they sleep. Over time, these episodes accumulate silently. Small vessel damage, microstrokes that produce no dramatic symptoms, just a little more brain fog, a little more memory difficulty. Until one night, it's not micro anymore. If you take nothing else from this video, make this the change you commit to tonight. Finish your last meal at least 3 hours before bed. If you drink alcohol, stop at least 4 to 5 hours before you sleep. And after dinner, walk for 15 minutes. Just gentle movement. That single habit alone, finishing dinner earlier and walking after, can reduce your overnight stroke risk more meaningfully than most people realize. Now, you've heard the 5 positions and habits that are silently working against your heart and brain every night. Let's talk about what actually works, because the solution is simpler than most people expect. The best position number 1, left side sleeping. And I want to share something here that even many physicians aren't fully aware of yet. Your heart sits slightly left of center in your chest. When you sleep on your left side, gravity is actively assisting your circulation rather than working against it. Your heart works less hard. Blood moves more efficiently through your body. Your brain receives better oxygen delivery throughout the night. That's the foundational cardiology. But here's the part that genuinely changes how you think about sleep position. About 10 years ago, researchers identified something called the glymphatic system. Think of it as your brain's dedicated overnight cleaning crew. While you sleep, this system flushes out metabolic waste, toxins, and the proteins that, when they accumulate, are directly linked to Alzheimer's disease. A study published in the Journal of Neuroscience found that this glymphatic system operates most efficiently when you sleep on your side, and particularly on your left side. Here's why this matters so profoundly. Every single day, your brain accumulates proteins. Amyloid beta and tau are the ones researchers study most closely. In people who develop Alzheimer's, these proteins build up and form the plaques associated with cognitive decline. In healthy brains, the glymphatic system clears them out during sleep. But if your sleeping position is restricting that clearance process, those proteins begin to accumulate slowly, not overnight, but over years, over decades. And by the time any symptoms appear, the damage has already been building for a long time. Left side sleeping optimizes that clearance, which means this isn't only about preventing a stroke tonight. It's about protecting your cognitive function 20 years from now. There's one more benefit worth mentioning. If you struggle with acid reflux, the anatomical relationship between your stomach and esophagus means that left side sleeping naturally keeps stomach acid where it belongs. You wake up without that burning discomfort in your chest. Now, if you've been sleeping on your right side or your back for 30 years, shifting to your left side takes conscious adjustment. Here's the practical solution that works. Use a body pillow. Hug it in front of you. It keeps your body oriented to the left and supports your spine throughout the night. If you have joint pain in your hips or knees, place a smaller pillow between your knees. It takes the pressure off and makes the position far more comfortable. The question I get most often, what if I roll over in my sleep? You will. That's completely normal. The goal is not perfection. The goal is spending more total time in the beneficial position than in the harmful one. Your body will adapt more than you expect over the first week or two. But left side sleeping isn't the right fit for everyone. There is a second position that works exceptionally well for specific situations. The best position number 2, elevated back sleeping at 15 to 30 degrees. Not lying completely flat, not sitting upright. A gentle, gradual incline that raises your entire upper body. You can achieve this with a wedge pillow, an adjustable bed base, or carefully layered firm pillows. But the critical detail is that your entire upper body elevates, not just your head on a stack of pillows. Why does this work? 3 specific reasons. First, blood returns to your heart more efficiently from your lower body. For anyone dealing with poor circulation, swollen ankles, or varicose veins, this inclined position reduces the workload on your cardiovascular system during sleep significantly. Second, pressure inside your skull decreases. For people with fragile cerebral vessels or blood pressure that isn't fully controlled, reducing intracranial pressure overnight lowers the risk of small vessel rupture. These microhemorrhages rarely produce obvious symptoms, but they accumulate into what doctors call vascular dementia, the slow erosion of memory and cognitive sharpness that many people mistake for normal aging. Third, your airway stays more open. If you deal with mild sleep apnea, chronic congestion, or sinus issues, this elevation reduces airway obstruction, decreases snoring, and improves oxygen delivery to your brain throughout the night. One detail that most people miss, and it makes a significant difference in comfort. If you elevate your upper body, also place a small pillow beneath your knees. This maintains your lumbar spine's natural curve and removes pressure from your lower back. Together, this creates what's known as zero-gravity posture, a position NASA originally studied for astronauts to distribute body weight and circulatory load as evenly as possible. A quick but important note. Elevated back sleeping doesn't work for everyone. If you have severe sleep apnea, even with elevation, the back position may allow your airway to collapse. The left side is better for you. If you have significant heart failure, left side sleeping is typically the stronger recommendation. If you have shoulder or hip arthritis, the elevated back position may offer meaningful relief. The point isn't to follow a rule mechanically. The point is to understand why these positions work so you can apply that understanding to your specific body and your specific conditions. Now, even if you get your sleep position exactly right, your body is giving you signals every night. Most people simply don't know how to read them. So let's look at them. The first tool worth considering is an overnight pulse oximeter. It's a small device that clips onto your finger and tracks your blood oxygen levels throughout the night. If your oxygen repeatedly drops below 92%, that is a meaningful red flag. It could indicate sleep apnea, circulatory issues, or respiratory problems, all of which independently increase stroke risk. The data this device gives you is valuable to bring to your doctor, especially if you've been experiencing unexplained morning symptoms like headaches, confusion, or fatigue. The second tool is heart rate variability tracking through a smartwatch or sleep ring. HRV reflects how well your autonomic nervous system is recovering overnight. Consistently low HRV is an early warning signal for inflammation, blood pressure dysregulation, and cardiovascular stress, often before those issues show up on any standard test in a doctor's office. The third tool requires no technology at all: a simple morning symptom journal. Each morning, before you do anything else, write down how you feel. Headaches, dizziness, numbness or tingling anywhere, brain fog, chest tightness. These subtle symptoms can be early indicators of compromised oxygenation or restricted circulation during sleep. A pattern in your journal over 2 or 3 weeks can reveal something that would never appear in a single office visit. One thing I want to be very clear about: these tools are for awareness and informed conversation with your healthcare provider. They are not a replacement for proper medical evaluation. If you notice concerning patterns, if symptoms are persistent, or if you carry known stroke risk factors, please discuss what you're finding with a qualified physician. Self-monitoring is empowering. It is not a substitute for professional care. But here's what these tools genuinely give you: data, awareness, and the ability to have a more specific and productive conversation with your doctor. You stop guessing, and you start measuring. Now, seniors, pick one adjustment from everything we covered today. Start with one. Commit to it for 7 days. Pay attention to how you feel each morning, whether headaches ease, whether you feel more alert, whether that chest tightness on waking begins to disappear. Your body will tell you whether it's working. Now I want to hear from you. Drop a comment below. Which habit are you changing first? Your answer might be exactly what someone else needs to read to recognize a pattern they haven't noticed yet. And if this gave you information you've never heard before, share this video with someone who needs to see it. Someone over 60. Someone managing blood pressure. Someone who keeps waking up with symptoms they can't explain. I'm Dr. Sarah Ellison, and I will see you in the next video.